Hello everybody, my name is Ibrahim Khan. I'm a family medicine practitioner with Lake Region Healthcare. This is the first in the series of lifestyle modification videos on anxiety. We're gonna go over the basics in this video. I don't want you guys to be mad at me because the basics in my mind are drinking water, eating properly, and sleeping. And you might have a reaction of like, well, of course, that seems so simple. Why are we covering a video on this? Let me make an argument to you. So these basics, if they're not necessarily tended to properly, can really cause a lot more anxiety in your life, and you'd be surprised how many people don't. So let's start with just the first, water intake. Water intake is critical. If you do not get enough water, your cognitive ability to function goes down, believe it or not. Your muscles don't get happy. All those signals go to your brain and might provoke more anxiety. So hydrating properly is a huge, huge part of your day. Food intake. A lot of people in response to anxiety don't really have very good food intake. Sometimes they have the opposite. They have a higher amount of food intake. Both of them can kind of stem anxiety. So low food intake can definitely cause anxiety because you're not getting those nutrients, and those signals again are going to your brain and you feel that. So your ability to deal with situations kind of changes because the brain is not necessarily getting, the messages that we have enough food, and then you add this added stress on top that may provoke more anxiety. If you excessively eat, especially those comfort foods can actually provoke anxiety, specifically if they're high in trans fat, they're high in sugar, they're stimulants, a lot of caffeinated beverages, alcohol consumption. All of those can possibly worsen your anxiety, and some of those are some of the food items that people tend to reach to when they're not necessarily feeling the best emotionally. So food intake can be critical. It's very, very important that you eat regular, healthy meals throughout the day. The final category I wanted to talk about is sleep. Sleep is obviously very, very critical. If you are not getting proper rest, you are going to completely throw off the hormonal balance of your body. Your stress hormones go up. You preferentially crave the bad for you foods, which could make your anxiety worse. If you're not getting enough sleep, your cognitive ability to deal with situations goes way, way down. So it's very, very critical that you get good and adequate sleep. If you're not getting good and adequate sleep, you feel like there's a problem with it, obviously go into your primary care provider as soon as possible and speak to them about that. There's a few things you can do on your own to kind of help out with that. Try and create a good sleep environment. Try and make it dark, not noisy, very calm, removed from stimulus around you that could kind of cue anxiety, that reminds you of work. This is all what we call basic sleep hygiene. We're going to go into that in another video on sleep hygiene, but these three are some of the critical things that we can do every day that, let's say you have anxiety and you don't have very good water intake, you are not eating very well, you're not getting adequate sleep. Just changing those three variables can really, really make a difference and make you feel a lot better, a lot less anxious, and your probability of experiencing anxiety in stressful situations goes way, way down. So I know this is basic, this part of the basic video that we're doing on anxiety, but these really can make a difference, and I hope you find it helpful. Thank you so much for your time.